We are conditioned to believe that something outside of us must fix us when in fact there is fear or lack of motivation to take ownership that I have to change, which can be daunting. This is a powerful statement made by my guest today. In today's episode, we answer three questions. How do neurochemicals drive different behavior? What are common triggers of nervous system imbalance? Where can we begin with treatment of imbalance? My dear friend Dr. Aarthi Soorya is a board certified physical medicine and rehabilitation physician who combines conventional medical training with leading edge concepts in biomedical functional medicine. She wears many hats including neurofeedback, hyperbaric oxygen, sleep studies, IV therapies and numerous clinical activities. Let's get started.
Hey everyone, I'm Deepa, light functional medicine practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey. Welcome back to the Sleep Whisperer podcast, Dr. Aarthi Soorya. We had you a long time ago. I think it was episode 2 or 3. I can't quite recall. And it's been 2.5 or almost 3 years since you were here. And since then, I know that your own personal journey has taken quite a bit of a U-turn. So I'd love for you to quickly get us started talking, especially since we're talking about stress and the polyvagal theory today. What made you have this epiphany that the simple interventions matter a lot? So we could get started with that, and then we could discuss stress, which is really, I don't think, prioritized enough. In spite of the word being spoken about a lot, we're not quite bringing enough attention to it personally.
Yes, thank you so much for having me back on. It's always so lovely to talk to you. We always have a good time. But, Deepa, you and I are both trained in functional, nutrition and medicine. And, while it's very interesting and it's very, you can learn all these biochemical pathways and where all these nutrients work, I think we oftentimes get lost in those details and we're not looking at the big picture. What my big kind of takeaway is, you and I are constantly learning, and big takeaway that I've learned over the past few years is that your biology is really going to respond to what your nervous system is sensing. We are still wired like our ancestors, even though we don't live out in the jungle anymore, but we have modern day tigers going on 24/7, right? So we have all these deadlines or, running late for appointments and relationship issues, financial issues, you name it. Those are stressors that are constantly breaking down our system, and our biology is going to respond to that. So whatever our brain and body does is meant to be protective to help us cope and conserve energy for the long term. So that was kind of how I've kind of shifted the way I think about patients, think about myself. How do I apply this in my own life? And so it's been, another layer of learning, but it's been wonderful.
And I think, Aarti, you did mention to me that in your own practice in the last few years, you've come across a lot of doctors themselves who probably don't bring enough attention to looking at these aspects in individuals. And could you share a little bit about how that looks like? So what does that look like when somebody chooses to focus more on this complex genes and complex testing while not looking at these aspects, and how is that relevant to the patient?
It's 100% relevant because I think what we're doing in one way or another in the functional medicine setting, even though it's labeled as holistic care, it's not necessarily fully holistic, in my opinion. And so the conventional side, you test for labs, you treat the labs. You're kind of doing the same thing on the functional medicine side and not looking at what is causing or driving those labs to be abnormal. Okay. And so what ends up happening is that, patients are then told they have these genetic deficiencies or genetic issues with these pathways. And that kind of ingrains in the patient in a way that, I have faulty pathways. When in fact, it's actually, if you look at the history, if you really pay attention and take a good history, the answer is usually there. And it's usually the person's interaction with the environment. And there are multiple stressors that are breaking down the physiology, and addressing it at a nervous system level, brain body base level, can help restore that physiology and help the symptoms go away. And so I think, in our culture, we're very conditioned to think that something outside of us has to fix us. When in fact, I think there's fear, or I think maybe lack of motivation in a way, to take ownership that I have to probably change the way I navigate myself in the world. And that might be a little too daunting for some people to kind of take on.
Oh, I think that's a powerful statement that you made. But then I think we need to also look at it from the other side, that this brings great power back to us if we can
I
use that
100% agree.
realization, right? So we're not giving that power over to something outside of us, and that's very empowering. But let's come back to the nervous system, because you did mention that it's so powerful and how everything we do, everything that happens within us. So how does the nervous system impact sleep?
Yeah. So, like I mentioned, we were wired for, survival. And so we're still wired like our ancestors. So we are wired to perceive threat because that is going to keep us safe. So if there's a tiger in the room or a tiger when you're outside, is it safe to go to bed? No, right? Because then you're going to be eaten by the tiger. So your sympathetic nervous system, which is your fight or flight nervous system, will release hormones and neurotransmitters to keep you awake so that you can be on alert so that you don't get eaten by the tiger. Okay. And so now in our modern day, like I mentioned before, we don't have tigers, but we have 24/7 stressors. We were only meant to deal with stress, which is, for short periods of time. Our body is able to adapt to that. It is designed for that. Even small stressors like exercise, even that makes you stronger. But left unchecked, that's when it becomes detrimental. So when it impacts your sleep is that if there's 24/7 stressors, your body's not feeling safe to go to bed because I'm going to be eaten by the tiger. Really, it's like I'm going to be eaten by my deadlines, my relationship, my finances, et cetera, et cetera, et cetera. And that's how it impacts the sleep.
And maybe, Aarti, we could share a little bit, both you and I, about what might be perceived stressors. For example, for me, it could be just having a difficult conversation, knowing that I have to speak at a public forum a few days later. That is a fear for me. I mean, I'm sure that fear looks different for everybody. And I know that for me, when I have an event coming up, that puts me into that fight or flight for several days, and it's still taking me a lot away from my sleep. So for somebody else, it could be the thought of a mother-in-law coming to stay. I mean, this sounds funny, but
no, you're 100% right.
In Indian culture, this is a scary situation for many people. So maybe you could give us some examples of that.
Yeah, absolutely. I mean, I'll give you one personal one. Like for me, whenever I would have to take a board exam for my licensing or whatever, I would lose my sleep for days. I was literally running on adrenaline. So exams can cause sleep issues. Getting a bad email from someone can cause sleep issues. An argument, like you mentioned, a difficult conversation. If you're stressed out financially, that can cause sleep issues. Race issues, like if you're in a country where you don't feel safe and you're like the minority, that can cause sleep issues. I mean, anything really can be impactful on the sleep because we each have our own capacity to handle stress. This can be trained, but we all kind of come into this world based on what our parents went through and all that. Our nervous systems are shaped based on that. And so we all have a certain capacity that we come into the world with. Some, can handle stress more, some can handle less, but the beauty is that you can train it.
What are the symptoms that we'll see if we are in a fight or flight? Because I think we do talk a lot. There's a lot of this spoken on podcasts and articles, but I find that a lot of times, many friends, they're still unaware they're in this perpetual fight or flight, and they're just looking at it as symptoms. And you mentioned also that sometimes, having this testing and genetics can make a feed into our mind. And I think that can also put labels on us, a label of fear, a label of a fear of a disease or a symptom. So what are all the symptoms that can come up and which are all related to dysfunction in the nervous system?
Absolutely. So if you're in a acute fight or flight state, that can show up as anxiety, fear, anger, irritability, ready to fight, like rage even. So think about all the things that's meant to be very protective for you, right? Because you're going to run away from the tiger. That's why you have those emotions, right? Because the emotions and everything are connected. That is meant to be life-saving for you. You're not meant to feel joy in that respect, right? If left unchecked, if you're always in a fight or flight state, your brain and body are smart. It's very expensive to stay in that state. So what it does is then it shunts you to the other side, like a little bit further than parasympathetic, right? Which is rest and digest, but then it almost goes further and shuts you down, which can show up as feelings of depression, sadness, fatigue, just almost depersonalized a bit too, numb. Those are common things that you could feel when there's been chronic stress, which can still impact the quality of your sleep.
And also, Aarti, I think when you mention anxiety, irritability, anger, these are things that all of us are oscillating between all the time. And I've seen a rebound effect as well, that, for example, in relationships, when somebody's showing anger, that can trigger anxiety in someone else. So obviously, these interplay with each other, they're influencing each other, they're aggravating each other. So when we see that as something coming from somebody close to us, that spirals us further into that dysfunctional nervous system. So there's so much to think about there. And all the symptoms that you mentioned, I think most of the world is struggling with in some way or the other. But let's come back to what are the common stressors that can impact the nervous system. I know we spoke a little bit about it, but I'd love for us to go a bit deeper into those.
Sure. So I talked more about, I guess, the life stressors, but other stressors can be, physical stressors such as sleep apnea, infections in the body, COVID. We're dealing with, this big pandemic, for the past several years. That in itself can be a stressor, right? This virus, and that upturned the whole world for the past couple of years, people's businesses and all of that. So that can impact us if you're caregiving for anybody, either a sick child or elder parent or something, that can also impact you. I think one of the things that we tend to do as human beings is try to push through, and without having that trained capacity of our nervous system. And that's where illness kind of starts to play out. and symptoms really start to play out.
And I must intercept a little bit, Aarti, with the Ayurvedic. Like all of what we spoke about is a state of vata aggravation and where fight or flight. And I mean, all of us have, and in Ayurveda, vata aggravation then pushes the entire body off balance, which is what you're describing as how the nervous system is such a priority in all of health. And I'd love for you, before we come to our takeaways, to walk us through a patient story where perhaps you were involved in the care, but there was also someone else involved in the care, and how it appears when one person is focused on the physical aspects, the gene testing, the complex testing, but ignoring the nervous system and down-regulating stress. And how your mind has always taken you towards prioritizing that, because without that, none of the other treatments are going to be effective.
Correct. Yeah. So in the world, in the functional medicine world, it tends to be like, oh, have this, 5-HTP supplement with GABA, which will help calm you down, which I'm not saying it's not going to work. It will work in the moment. It will help you calm you down. For those of you who don't know, 5-HTP is the precursor to making serotonin. Serotonin will help you feel calm. The thing is that, again, what I mentioned was that what is driving that biology is the nervous system being ramped up. So you're not meant to feel calm if you're ramped up. So the root cause is actually getting to the nervous system, which you mentioned is a vata imbalance. So that's good if you need someone to just help take the edge off while you work on correcting behavior and whatever other life stuff that you need to incorporate, diet, food, all of that. That is key, because that's going to keep you healthy, happy, long-term. The supplements and the medications, those are great tools, but you should not be relying only on those.
Aarti, how do you tease out from your patients the state of their nervous system?
You can pretty much tell when they first, they're coming in to talk to you, and how they sit, how they are like interacting with you. Usually if they're very, very like sympathetic state, they're on edge, they're going from one topic to the next, they can't sit still, they're very anxious. And then after, then on the kind of the contrast side, if that's been going on for a long period of time, like several years, people can then start to show up as a little bit more shut down and numbed out, a little more depressed, low energy feeling. So just kind of seeing where they're at, that can also kind of help tease out, where do I begin with treatment?
Where do you begin with treatment?
Great question. So I always for most people, I feel like we're running 24/7. And so just building in time to where there's no stimulation, because we are too stimulated 24/7. We need to actually give the brain body a rest. And we've normalized being stimulated 24/7. And that, with social media, with TV, news, notifications, all of that. So just starting with, what can we minimize in terms of your inputs, because your brain and body were not meant to handle that many inputs. So like starting that, usually I start people off with yoga nidra, because that's a really nice way to, mindless way almost, right? People don't have a lot of bandwidth when they're first coming to see me. So yoga nidra is great, because if you can lie down and just listen to someone guide you, that's all you have to do. And that can start to calm their nervous system down. And, even if I tell them, if they're so anxious, even if you do 2 minutes, that's great, because that's starting to build that capacity.
I love the gentle approach you use, Aarti. It's not about perfection. It's just starting wherever. But I do want to clarify before we come to our takeaways that you mentioned how these stressors can be in the form of the notification and the cues, and we're constantly being bombarded. And Sadly, almost all notifications show up as red. And I must share something that I was working with someone recently who had me put up a goal chart for myself and said if I hadn't done something this week, I need to flag it red. And I said, no, I would not do that because I'm in a world where I'm telling people how to let go and calm down. And red to me, I think, sends a signal of emergency. Red to me signals something. So I said, no, I'm not going to use that color. And I was sadly taken aback to notice when she mentioned that almost all the top coaches in the world use the system of red to alert somebody that they have not done something. And I feel that these are all contributing to this dysfunction in the nervous system. So maybe we need to just bring our attention to where it might be unique for us. Maybe we need to do a little bit of a personal audit in terms of what in our life is triggering that state of emergency within us. So what is that going to do to the kids? Because my son recently got Instagram, and when you spoke about the notifications, what's this sending to the kids of today?
Oh, I think it's definitely having an impact on their brain health, their ability to concentrate, and actually when it comes to schoolwork is probably compromised. Because remember, the brain is always going to be adapting. And if there's too many stimulants, it will actually tune out, right, to conserve energy. So then now kids are being diagnosed with ADHD and all that because of actually, I think, too many stimulants or not a safe environment, you name it. But it's more of an adaptation that the brain is making. We, I think, tend to treat our brain and body as these isolated things that just dysfunction on their own. But if we start to look at it as adaptations to the environment, then all these symptoms start to make more sense. Why is it doing that, right? So, I'm not saying that there aren't genetic-based diseases. There are 100% that will be penetrant, but most of our things that we're dealing with are not necessarily genetic.
And even if we do have the genetics, that doesn't guarantee something for us.
Exactly.
We have so much in our own hands. Let's come to 3 takeaways that we can do if we are in this heightened state of stress, if we have those symptoms which indicate our nervous system is dysregulated. I just wanted to share 3 takeaways. And I know you mentioned yoga nidra, so I'd love for you to start with yoga nidra and just describing to somebody who doesn't know what is yoga nidra and where might they access, how might they do. And we have some mini versions on the podcast as well.
I know you've your voice, you have narrated some sleep-based meditations, right? So it is a conscious sleep. And so what it's doing is training your brain to kind of slow down. Our brain is very metabolically active. So it's slowing the brain down so that you can get into those deep stages, which is like the slow wave sleep, where body and brain can repair. And so we never really get into those deep stages anymore. I'm convinced a lot of people are just not getting there because of all of our stimulation in this environment. So that's one way to kind of help start to train the brain body to get in for a repair mode, right? The other is like starting to bring awareness to the fact that when you are in a stressed out state, what do you feel? Like, bringing awareness to that, because a lot of us, the physiology just goes rampant and you're like pissed off and you're just kind of going with it. But bringing awareness to it, then that can kind of start to have you gain control over the physiology in a way. So being like simple as, okay, yeah, I'm getting pissed off, but okay, my feet are on the ground. Scanning your environment, right? We're thinking there's a tiger, but if you just tell your brain the inputs, like, okay, I'm looking at my computer, there's a plant next to me, there's my coffee mug, just scanning the environment will tell your brain, okay, there's just no tiger. So it's a grounding exercise.
Perfect, Aarti. And I think you really made a valid point that a lot of times most of us don't realize at that moment that we're feeling that way. We get so taken over by the emotion, and it's always fascinating to hear patients and clients talk about how I never realized the argument with my spouse was spiraling me into my symptoms. And when you bring attention to that, they are more mindful about, because they see that it's having a negative impact on them. Where can they find, like, if do you suggest to your patients any time of the day for yoga nidra, or any
Usually,
specific?
usually because they're so scattered when they first come see me that, I usually say just first start off at nighttime. It's probably the easiest time for you to actually incorporate it in. Start off there. Most people have sleep issues anyway, even though it's, not technically supposed to be done at night. It's a conscious sleep that's, morning or afternoon. But that's where I start off with most people, is at nighttime. What can I do that's the least bandwidth so it doesn't feel overwhelming for the patient is my goal. So do it then. If it's not possible at night, I was like, pick a time that works for you. Whenever. I just want the habit. That's all I want. And so that's kind of how I approach the timing of it for them.
And share 2 more takeaways with us on how might we improve our nervous system.
Yeah. So, power down hour before bed. That would be, a great way to kind of start to decrease the stimulation so that your brain knows it's time to go to bed. So no electronics, no emails, no news, just what can get you into a nice relaxed state. So for some people, it's gentle yoga, stretching. I'm fine with reading as long as not like something intense, like light reading is fine. Just starting to calm that nervous system down. And wherever you can build like even 30 seconds in a day, just starting to weave it into your daily schedule, that can also help start to build your resilience and capacity. One more takeaway. So we did yoga nidra, we did grounding, we did power down hour.
Right. Okay.
Yeah.
So maybe you could just wrap this up for us by sharing where can someone begin? Because I know that it can be overwhelming even to have 3. So how do you just start, like wherever it is? And is it more important that we do a little every day or longer
I always
whenever
say
we get
start
time?
small. I always say start small because you want to build the habit. If you go and say, I'm going to do 45 minutes of a meditation and have never meditated before, or you've never done yoga nidra before, that's probably going to stress you out more. So I would say just start very, very small, build the habit, and then just you can increase the time once your nervous system adjusts.
Beautiful, Aarti. And I know that if there are people outside who were like me before, who are perfectionists, and if we can't do it perfectly, we're not going to do it at all. But I've changed so much. I'm constantly unlearning and relearning. And I think that for me now, it's about, somebody pointed out to me recently that she said, your perfectionism is what makes you do well at work, but it's also what defeats you when you're pulled out of your comfort zone, and it's what overwhelms you completely. And she hit the nail right on the head. Right. And I think a lot of us are like that, where we feel if we can't do it. So I've started to unlearn that. Okay, if I can't do 30 minutes tonight, let me just do 5 minutes of whatever, and then anything is better. And I think that's what you brought our attention back to. Thank you for being here again today. Where can people find you if they'd like to know more about your work?
Yeah, absolutely. So you can find me on Instagram at Dr.A Soorya and on Facebook at Aarti Soorya MD. And the practice I'm at is at groverhealth.com.
Thank you
so much for having me.
Aarti, it's always a pleasure speaking.
I always enjoy our talks.
I'm sure you enjoyed this conversation. I will end by once more sharing how letting go of my perfectionism, having boundaries, and clear switch off times have transformed my response to trauma and stress and helped me with my sleep. From being defeated by a history of trauma and having very poor resilience to stress, I've come to a space where my clear boundaries for myself and my day have now become non-negotiable factors. I'd really encourage you to start by even just switching off all devices earlier in the day. I do believe there is a difference between silent mode and airplane mode, and the airplane mode almost tells my subconscious mind that there is nothing demanding anything from me. Fix a time and be consistent, and notice how your response to stress improves manifold. Have a great day. This podcast is intended to provide helpful and informative material on the subject matter covered in the episodes. The podcast is not acting in the capacity of a doctor or a registered dietitian and is not rendering any professional healthcare or medical service. The information in the podcast is not intended as a substitute for medical advice or services or as treatment or cure for any particular health condition. The advice and tools contained herein may not be suitable for your situation. Any medical questions regarding contraindications and cautions, or any questions on whether or not to proceed with any practices provided in the show should be referred to qualified health professionals before adopting the same. The podcast specifically disclaims any responsibility for any liability, loss, risk, personal or otherwise, which may be incurred as a direct or indirect consequence of the use of information from this podcast or the application, adoption of any of the information provided.